Hello and welcome to Southern California MD Magazine. I'm your host, Dwight Cromie. On this episode, we'll be talking to Dr. Watson and Dr. Mustafa-Infante of Mission Pediatrics. Mission Pediatrics specializes in full-service pediatric care. They have offices located in the cities of Paris and Riverside, flanking 3 major hospitals in which they provide care. They are both pediatricians, and Dr. Watson is the new medical director and CEO of Mission Pediatrics. Mission Pediatrics provides accessible, full-service care and 24-hour emergency on-call services. Their experienced staff is dedicated to providing quality and gentle, compassionate services to their patients. Dr. Watson, can you tell me, pediatrics or Mission Pediatrics is supposed to be different than other pediatrics clinics in the area. What makes your clinic different?
One of the things that we think is extremely important is that we provide a service where the doctors, the staff are happy, they enjoy what they do, we come to work with a smile on our face, and we're accessible to our patients. We really make a great effort to provide the full service components associated with pediatric care. Patients can call us 24 hours a day, they can send emails if they like, they can reach us right in the middle of the clinic hours if there's a problem or a concern. And we work at all the local hospitals so that even if they go in, the hospital emergency rooms can call us and we can take care of our patient.
Pfizer, can you tell me, when we talk about quality or compassionate care, what is it that your clinic is offering?
Yes, basically our difference is because we really enjoy and we love what we are doing in our clinics.
Tim, can you tell me, what made you decide to be a pediatrician? Of all the different medical practices you could go into, why pediatrics?
Well, the short answer is the diapers are a lot smaller, and I can actually tolerate it a little bit better. The reality is I'm a kid at heart. I love children. I've always enjoyed working with kids, but you know, the journey that led me there started out after college, a lot of different odd jobs. I eventually became a school teacher, and I did that for a few years, and it really kind of honed me into recognizing the huge health needs in the pediatric community. And that's sort of what sort of jump-started me into going into medical school and becoming a pediatrician. And I haven't looked back. It's been great.
Pfizer, what about you? What made you decide to be a pediatrician?
Well, I decided to be a pediatrician since very early in my life. I remember when I was a kid, I was doing some community work and job with my mom. And since then, I guess I was feeling the necessity to be more educated and be prepared to help my underserved Latino population.
Do you have kids, Tim? And how does that affect your family life?
Oh, yeah, I have 3 children, 5, 3, and 1 years old, which means I really have to drink a lot of coffee. In fact, I think the rule is for every child you need to drink 1 pot of coffee, so I'm a little behind right now. Thanks. It affects my family in the sense that I have to wear 2 hats. I'm a dad and I'm a pediatrician, and it helps me from a pediatric side to understand what parents are going through. I don't think there's a stupid question. When somebody calls me, I get it. When they're worried about their sick kid in the middle of the night, I've been there. I've held my sick kid in the middle of the night. So it helps me to empathize and feel for my patients' families and their concerns.
And Pfizer, do you have kids, and how does that relate to your family life?
Yes. That is a common question coming from our families. They always want to know if we have kids and what is the age of our kids. And definitely it's very important because, and actually for me it's important as well, being a pediatrician, we need to understand what is going on with kids. Having kids, I have 15 years old and 8 years old, so absolutely it's great for me to see how they grow, how her mind change, and we can understand a little bit better what we do every single day in our offices.
It sounds like you both love your job, but I understand that you, Tim, do some magic tricks for your patients. Can you tell me a little bit about those?
Oh, well, when I was 12 years old, I went off to a camp that kind of among other things, we got to learn magic. And since then, for many years now, I've just had a ball learning how to do fun little magic tricks. My patients seem to kind of enjoy it. I might run up and pull a sponge ball out of their ear and make it disappear. And that's kind of fun. I think patients have a good time with it. Sometimes I'll even, do you mind if I use you as a guinea pig? Sometimes I'll even kind of push on something and it'll squeak, and if somebody has like a little place that hurts, I'll say, now it squeaks, and that kind of stuff is just, it's kind of fun for me. It's fun for the patients, and in the end it kind of takes the worries and brings them down a little bit. People feel a little bit better.
Now, let me ask you, there's a lot of health issues out right now. What are the concerns that you're seeing your parents come in with right now? What are their major issues or concerns health-wise that you see?
The economics now are really difficult, and everyone is struggling financially to make ends meet. With all the worries about health care and coverage, a lot of families have lost their jobs. They've lost access to the private insurances that they might have had before, and they sometimes worry. We take patients with both private insurance and Medi-Cal, patients who are on state assistance and those who aren't. We don't want to put an office where the insurance determines whether or not you get quality or care. We want these patients, all of our patients, to understand that wherever you come from in your background, we're going to give you good quality and good care. And that's something that's a little different from some offices in town. We don't kick somebody to the curb because they've had an insurance hiccup or a change. We really try to provide a way to bridge the gap for those patients. And patients are pleasantly surprised. They come to the office and they think, oh, well, I've now reduced to this level of insurance, and are you going to treat me poorly? And they find, in fact, no, we treat you with high quality, good respect, and because the child at the same or higher level than they might get anywhere else in the community. My parents grew up with very difficult times and didn't have access to health care, and I think when I see a little kid, how do I know that kid isn't my parent as a child growing up? And I feel it's my duty and my honor to be able to take care of those little ones. And their parents can make great decisions that lead to great opportunities or make poor decisions that don't. But that child should not be held hostage to those life experiences they can't control. So that's why I think we really can bridge the gap. And that's where the name Mission Pediatrics kind of shows there's a mission to what we do. It's to providing good quality and providing opportunity for patients that maybe otherwise wouldn't have it. And it's something that brings me great satisfaction to be able to do.
I want to switch gears here a little bit. Can you tell me, as physicians, why did you choose the Inland Empire as a region to practice medicine?
Well, actually, that is a very interesting question, because going back to my medical school, I get my training in medicine in my Latino country in South America, and since then, the only thing that I know to do is practice pediatrics with my Latino population. When I came here to United States, I get my training as a pediatrician as well, in a community environment as well, and my only idea was always working as a pediatrician with my Latino people, and that is the people who really has something nice to say, to tell us about. Thank you so much for your time, for spend hours and hours with my kids. I really like working in the environment at Riverside community.
A young physician that's looking to grow his career, who is compassionate, who's looking to really practice medicine, this is a good location?
I think it's fantastic. There's a lot of opportunities. You can join the big groups. You've got Beaver Medical Group, you've got Loma Linda Medical Group, you've got Kaiser, you've got Riverside Medical Clinic. These are the big groups. And if you want to sort of ease in and sort of understand the experience without sort of feeling that vulnerable, alone experience, that's a great opportunity. But there's tons of small groups, whether it's a 1-doc practice or a 2 or 3-doc practice. We have 5 practitioners in ours, 2 PAs, nurse practitioner, and the 2 of us. And it's a great team. It's vibrant. They're excited. They have a good time. But there's a lot of places to work. There's community hospitals, there's university medical centers. UC Riverside, we're just really excited about medical school, you know, coming up and succeeding. These opportunities, I think, really provide a rich ground for the doc who wants to dig in and work. And I'm just excited to bring on new colleagues, whether you work with me or I'm just sending you business or we just sit and chat at the hospital. I personally am a fan of the doc who tries to kind of join a little group and try to understand it from the ground up. I think your pulse is on you feel your fingers on the pulse of the needs of the community when you're in a practice like ours.
Well, I want to thank the two of you for your time. I really appreciate you coming in and talking with us. As you can see, Mission Pediatrics is truly dedicated to providing gentle, caring, and compassionate services to all their patients. If you want to learn more about their services, click on the web link to the right of your screen. I'm your host, Dwight Cromie. Thank you for watching this edition of Southern California MD.